Welcome to Elevated Practice, where we interview masters and mavericks within the field of holistic medicine and uncover unconventional stories in the field of health and wellness. I'm your host, Gretchen Badami, and every episode I'll be interviewing clinicians, scholars, entrepreneurs, and educators who share their wisdom and ideas with you. Are you ready to elevate your practice? Let's begin today's episode. I'd like to extend a big thank you to Handcraft Health for sponsoring Elevated Practice and empowering integrative healthcare practitioners to create personalized healthcare packages for their patients. Create a free account today and elevate your practice at www.handcraft.health. And now, on to today's episode. Today, I am here with Dr. Lorraine Wilcox. When I was perusing people to interview for this podcast, I reached out on social media to many practitioners in the holistic medicine field. And across the board, one of the people who was repeatedly mentioned that practitioners would love to hear from was Dr. Wilcox. I think for many reasons. She has made so many translations which make our medicine accessible, and her humility and ease of communication and teaching. She has been licensed for over 35 years as an acupuncturist. She has her PhD in classical Chinese medicine and is self-taught in Chinese. She did her dissertation on moxibustion in the Ming Dynasty, and she has been teaching in universities and colleges since 1990. She also teaches continuing education classes, both in person and online. She has authored and translated at least 10 books that I'm aware of, maybe more. I was looking at a few snippets online and quotes of yours, Lorraine. And you've mentioned yourself as a clinical anthropologist, researching and reviving Chinese medicine. I love that phrase. And as we talk today about things that you've translated and medicinals that you've made and studied, I think that that phrase will come to people's mind as we discuss some of your areas of focus. Welcome.
Thank you, Gretchen. Thank you for having me here. Thank you for inviting me. Good to see you.
For those of you who are listening, I've known Lorraine for a long time. Initially, I got to know her as her student at Emperor's College. And then as I've been teaching at the college for a decade, we've been colleagues, friends, and she continues to be a mentor. I've asked you lots of clinical questions throughout the years, and I admire you very much. So thank you for coming on here today to talk.
It's my pleasure.
As we talk about your history, I think that our listeners would love to know a little bit about what brought you to this medicine. How did you become interested in classical and traditional Chinese medicine, and through that, herbology and acupuncture? Where did that interest begin?
It's not really a very interesting story, but I moved to Los Angeles in 1983, and I instantly hated it because I came from a real city, Washington, D.C. Well, I had been living there for 10 years, and I just hated how spread out it was, and there's no public transportation, and you meet somebody you want to be friends with, and you find out that they live on the other side of the universe, and so it's not practical to be friends. And I had gotten to dislike my job, and I always liked learning things, and so I was looking around for schools to go to, and it's like, wow, they have schools of acupuncture here? That's pretty neat. That's strange, and I always like strange and weird, so I just took a class. I had never had a treatment. I had never taken Chinese herbs. I had never had any interest in it. And I took like the basic theories class or fundamentals class, just, at night after work. I fell in love from the first class. So I just kept doing it. And I didn't even feel like, I wanted to practice. I just wanted something to occupy my mind.
Mm-hmm.
I finished the program.
You finished the program, and then you went on to do many things with this medicine. Initially, it sounds like starting off as a clinician and working in LA, and then your interests shifted more towards scholarly research and translations. I'm wondering how you taught yourself Chinese and then shifted your interests into reviving old texts and old medicinals.
So I don't understand humans. And so being a clinician is kind of hard to interact with humans. I mean, I've always been a book person. I've always read. I've always been interested in words and etymology and so forth. And at some point, I kind of got bored with Chinese medicine because back then there were very few English books, and I felt like, okay, I've conquered this enough. And so I started studying with a feng shui teacher from Hong Kong, and he wanted to teach a class, but he didn't really know how to put certain things into English, like the names of stars in Chinese astrology. And I said, "Oh, I can help." I mean, what he basically wanted was the pinyin, even though he didn't know that's what he wanted. I was used to Chinese herbs, learning the herbs by their pinyin name, and so I bought a Chinese to English dictionary and I figured out how to look up words in it. And I just got the pinyin for all of the names of more than 100 stars. I tried to translate the names, and from that, I just started trying to translate mostly feng shui and astrology related stuff, but I didn't have grammar. And so I could know different nouns and different verbs, but I didn't know who did what to whom without the grammar, right? So that was the start of it, just me fumbling my way, in the evening rather than watching TV or doing crossword puzzles. After a while, I started to try with Chinese medicines, and that's when I fell in love with Chinese medicine a second time. And from that point on, it's lasted.
You made it real for you in a way that maybe clinical practice didn't, but then finding and discovering and exploring these old texts sounds like it really hit a chord with you.
Yeah, somehow it spoke to me more than living humans.
And then through that, you did a deep dive into moxibustion around the time of your dissertation. I have two of your books right here that I have referred to often in my practice, and then even I had the good fortune of being able to take a moxibustion class with you also while I was doing my master's. And so, how did you end up at first getting interested in moxibustion?
So when I went to school, all they used was stinky moxa sticks. And, in the books I'd seen, there's this thing, indirect moxa, but I never once saw it used when I was in school. And so when I was looking for something to write about in my dissertation, one of the things I thought is, let's see what Chinese medicine says about moxa besides stinky moxa sticks. I was really surprised at how much literature there was on it and how revered it was in the past, rather than people groaning, "Oh, do I have to do moxa?" And how many techniques there were, and how many things that it was even the primary treatment for. I tend to get obsessed with something and fall down a rabbit hole. And so that was one of the first rabbit holes. That had been enough years that I had gotten better at translation. I'm not saying I was good, but I was better at translation by that point.
And those two books then you wrote. And I can only speak for myself as someone who is educated in America and a native English speaker. What I can say is that for those of us who are native English speakers educated in the United States, your moxibustion books are the magnum opus for us, and have really brought so much accessibility to us practitioners. So we're very grateful for those. And then when I was looking up information about you before this interview, and I knew this, but I didn't know all of the details. You've published many translations in the recent years. Miscellaneous records of a female doctor, an outline of female medicine. I thought this was amazing to see some of the work that you've done regarding women raising the dead and returning life. So you've done many translations, and how has becoming a translator of this medicine informed your scholarship over the past few years?
As far as translation goes, I wanted to be somewhat useful today. like there are a lot of really interesting books, but they have like nothing that you or I would dare use in clinic, or like the formulas are all with herbs that we can't get. Or one of the criteria is like, is a good percentage of this still usable? Another criteria is, am I capable of translating this? Because if a book is really theoretical, that's so much harder than if it's about herbal formulas or point indication. Do I like the information in the book? Does it interest me? And then I do have a taste for strange things. So, for example, Raising the Dead and Returning Life has a lot of strange stuff in it as well as usable stuff. It's kind of a mixture. The publisher and me, we picked and chose passages from a much longer book, and those were the criteria. It had to be interesting, usable, and or strange, but no harm to animals and stuff like that.
As I was looking at these books, and then I was looking at the description of some of them, many of these formulas in these books are still, relevant today and able to be used, and don't have an abundance of toxic materials. And actually, I was speaking last night with my husband, who he actually took a class of yours once long ago, telling him how amazing I thought it was when I saw the miscellaneous records of a female doctor, that here you have someone who, back in the Ming Dynasty in the 1500s, I don't know how many female doctors there were at that time, but certainly their notes were not written down and handed down through posterity. We just don't have a lot of this information today. And so to bring something like this back to life and to make this accessible for clinicians today, to see how someone as a woman was treating patients and treating female disorders, was just very inspiring to me. And I just wanted to thank you for doing something like that and bringing that to life.
And speaking of bringing it to life, then this author, Lisa C., who writes a lot of books about Chinese women, she wrote a novel about Tan Yun-shen's life, this woman doctor, and that's recently come out, and I think it's just now out in paperback. Talk about bringing it to life. I kind of brought her words out, and then Lisa made a story around it. It's not, it is fiction, so she had to supply a lot of stuff. And since I am a Chinese doctor, when I read, there are a few things, I wish it was a little bit different, because Lisa C is not a Chinese doctor. But all in all, it's a great read. It's fun. It really does bring her to life at a whole new level.
That is amazing. Her name is Lisa S.E.E.
She wrote some books like Peony in Love and Snowflower and the Secret Fan. And I, really liked those books when I read them. I should read them again.
What is the name of the fiction novel that she wrote that's based off of your translation?
Lady Tan's Circle of Women.
I bet a lot of our listeners will be interested in that, and I will probably go out and order that book now myself.
You can find interviews with her online that have been recorded about the book if anyone's interested. It's especially fun for us practitioners of Chinese medicine to read and picture what it must have been like treating patients. Although Lisa C made her much more focused on only people within the family compound. And I kind of suspect she did have more outside patients, but she only treated women. But I think, people came to see her and ask for treatment from outside the family. They had big families back then.
Through your research that you've done, if there was a woman doctor, would she primarily just treat women, or would women doctors sometimes treat men as well? Do we have access to that information?
In the Ming Dynasty, there was a strong separation of sexes, and if you were in the upper classes, which Tan was, in a class of literati families and government officials, so she was upper class. So there was a lot of separation between the genders, between the sexes. And so she would probably only treat women and children, maybe male children, if they were young enough. And that's probably true for any educated doctor. So in Chinese, there's this word yi, which means doctor or medicine, and that's used for the educated doctors. If you were lower class and if you were a midwife or if you were some kind of granny doctor, you wouldn't use the word E. They had other words for those kind of healthcare practitioners. There was less separation of the genders among the lower classes out of necessity. They couldn't afford to keep women hidden, own section of the house. The woman had to go out do work out in the community selling things or whatever, which would involve interaction with people of other genders. Todd probably would have treated men in emergencies, but not, as a regular thing.
Another thing that I wanted to ask you about is that you have some translations of some texts which are emergency medicine and traumatology. And when I took class with you, some of the medicine making that we did were topicals and creams and balms for burns. I remember there was even a lip balm that I think we made. And so I wanted to ask you a bit about your experience of medicine making. I don't know if that came about through your translating of traumatology and formulas or where that came from. Here.
So actually, it started with the Moxa translations. When I was translating, sometimes it was hard to understand the instructions without actually trying it and seeing how things went. I had a friend who did a lot of hiking, and I didn't know the native plants, but I asked her, there's local mugwort I hear, can you show me some? And so she took me out and I harvested some and I hung it out to dry. And then later I played with grinding the leaves to make moxifloss and then seeing it age. And so I started trying hands-on things when I was translating because it would help me know how to translate better. I read a lot of academics' writings, and sometimes they'll say stuff that just is wrong because they've never had their hands on. And so a word can be translated this way or that way, and they pick the wrong way sometimes. And so I just started doing that. And I've always been interested in the Shanke or the Jiedan, the martial arts and traumatology. So I played around with translating some stuff. Some is published and some isn't, but that made me also just want to start trying to make some of these formulations and see how they work. And I fall down a rabbit hole and get really deep into something. And then when I feel like I've conquered it, then I get bored with it and find a new rabbit hole to fall down. So I did that for a lot of years and was teaching classes. And then during COVID, I just started making videos. So I have a YouTube channel and I've got lots of videos on how to make ointments, how to make plasters, how to make liniments, how to make, all kinds of things. I've got, some videos about the I Ching, the Book of Changes. I've got a bunch of videos on different topics, but there's a lot of medicine making videos on the YouTube channel if somebody's interested.
I know I follow you on Facebook. You have a medicine making page. For anyone who wants to find you on YouTube, do they just Google your name or
Just
how do they
Google
find
my
your
name?
Okay. And I know that also you have a number of CEUs that are on some of the CEU platforms as well, where you teach medicine making.
I did a few about medicine making. Of course, that would be better in person. But if you're highly motivated, you can learn from a video.
Yeah.
And if you have the background knowledge of Chinese herbs. Yeah.
Right. If you're able to get the appropriate equipment and the herbs. And then speaking of medicine making and medicine in general, and herbs, when we talked about doing this podcast, one of the things that you have mentioned, which I am very interested to learn more about, is the difference in ways that we can utilize our herbs and utilize formulas when we're consuming them, when we're prescribing them for patients. Many of our listeners probably give granules and maybe granules within capsule form or tablet form. Maybe some people do prescribe decoctions that are already made and come in packets, or maybe people actually give the loose raw herbs and have their patients go home and boil them. There are so many different ways of consuming our herbal medicine.
But I just think little by little, we're chipping away at the efficacy by ignoring some of these matters.
Let's pause for a moment to extend a big thank you to our sponsor, Handcraft Health. I prescribe a lot of herbal medicine in my practice, and quite frankly, I don't want to spend the overhead keeping hundreds of herbs and supplements on hand. Since the pandemic, I do a lot of telehealth consults and ship patients their prescriptions. Handcraft Health has been my lifesaver. It allows me to have a successful and streamlined practice and saves me money and office space. I am not tech savvy, but the platform is really straightforward for me to write and easy for my patients to pay online and receive their orders at home. It's free for practitioners to open a Handcraft Health account. It's just handcraft.health and only takes a few minutes to sign up. It's one of the easiest choices you'll make to do what you do best. And now, back to our episode. Yes. When I prescribe my patients formulas, one thing that I always speak to them about is that if they're not taking enough and they're not taking enough dosage, because certainly if you give someone a bunch of capsules and they only take 2 or 3 and they only take 1 dose a day, it's not really doing much good. So I say, these are herbs. You have to have a large enough dose for it to affect the body. And I always have felt that the capsules just aren't enough dose to do a lot of good. I have to prescribe so many to get the same amount of effective material within the body as, say, when I prescribe decoctions and the plastic bags with the liquid decoctions within them. But to think about the reasons of what herbs you're giving in what formula and what would be the best way for the patients to absorb and based on their diagnosis to take the herbs is an entirely different level of nuance that we should probably all be learning more about.
I have a couple other things to add, if that's okay.
Please, yes.
So in my research into powders and powdered formulas, and again, I mean ground up herbs, I don't mean granules. Okay, I use powders for ground up herbs. I use the word granules for granules. I don't use the word powder for granules. Because you need a separate word for each thing to differentiate in order, to make convenience, because modern people just aren't going to do things that are too inconvenient.
Unfortunately.
So you grind up a bunch of the powder at one time. You don't grind it up day by day. That's too much of a pain. There was a study done by some Japanese about using a French press to, you put the powder in, just like you put, coffee in the French press. You pour the water on top. You stir it for 20 seconds. They said the results were much better if it was stirred for 20 seconds. And then it steeps for 4 minutes. And then you press and pour off the top. And there's a tiny bit of sludge in the bottom, just like when you do French press coffee. There's some grounds in the bottom a little bit. Mm-hmm. At least when I do it, that's what happens. In this study, they found they use certain marker chemicals for particular herbs like huangqin and ma huang and stuff like that. And they found that 4 minutes of steeping as a powder in a French press had the same or greater of those marker compounds than boiling those herbs in water for a certain period of time. You can buy little, very small French presses. I have a couple of them. You could sell those to patients and have them just make it if they can make French press coffee or some other kind of fancy coffee, then they could make herbs this way. But of course, not every formula was made to be powdered. And then there is the issue, who's going to do the grinding? Do you have a grinder in your clinic? Grinding is a pain. Some other people, especially Julianne Nugent-Head, has been talking about a thermos method. I don't know, they may not be the original ones, but that's where I first heard about it. And, it works really well. You'd put the amount of powder in the thermos, or it could be raw herbs, but powder has more surface area. If we're talking Western thought, you pour the hot water on top and then you let it sit overnight, not just 4 minutes, but overnight. And you can make enough for a couple of doses in one day. You don't have to just do 1 dose at a time. And that seems to work really well too, but then you have to strain it. So you can use some kind of coffee filter or something to strain it. So that's another thing that's relatively convenient. Maybe it's not
It
as
is
convenient as
yeah.
granules, but it's still relatively convenient.
Yeah. If if you're able to take that extra step in your clinic of either putting together the raw herbs or grinding it into a powder and then giving it that way to a patient, it seems actually quite easy for them to just boil the water and steep it overnight. Since we spoke, I actually looked at some of those videos myself that you had mentioned with the thermos method. And am eager to try that myself with some of our herbs. I wonder, have you thought about why? And I have a few ideas, um, not just with the surface area, but I know with some of our herbs, if they are boiled for too long, and especially when we think aromatics or other herbs that have a lot of volatile oils, the boiling can then degrade, their molecular compounds if they are cooked for too long. That's my thought with some of these herbs if they are overboiled. Do you have any other thoughts on why, historically we learn to decoct and the general amount of time is for 30 minutes to be, boiled and then simmered? Why this thermos method or French press method may actually prove itself to be more effective in terms of the active ingredients?
Well, they didn't have thermos or French press to try it before, but some of the powder formulas you would just pour the hot water on and then let it steep and then drink it. So, it's a little more convenient with the French press to get most of the grounds down to the bottom. So that method is pretty similar, except you're just using the contraption to strain it. I would question, you said, the traditional method is 30 minutes. It's like, well, who says that's the traditional method? That's what you learned in school, but they didn't have clocks in the old days, so they couldn't have said 30 minutes.
Right.
Generally, what the formulas say is that boil it down to 70% or something like that. So if you have this much water, you boil it until it's 70% of the volume, or 60% or 50% or 80%, so different recipes would have different things, but they didn't measure by time because they didn't have clocks. And so the French press would be perfect for aromatic herbs because you're
Yeah.
not boiling the herbs.
Yeah.
For a lot of the formulas, you're supposed to have fresh ginger, or like with San, not only fresh ginger, but woha peppermint,
Hmm.
or sometimes, a datzao, or, the date or something like that. So you have to decide, like, will your patient, if they will do the French press method, but will they add some fresh ginger? And if not, what do you do? And I know there's somebody named Aaron Evans, I think is his name, and he says that his teacher, Huang Huang, just puts dried ginger in. He's given up on trying even to get Chinese patients to put fresh ginger in, so he just puts dried ginger in. But that's a question you have to, decide if you're going to use these kind of methods.
Right.
Um,
What sort of compliance will your patient actually have? Right.
yeah, yeah.
Right.
So
Wow, there's a lot of food for thought here.
there is. Can I give a shout out for like homemade herbal? So let me tell you this story. I'm not the big practitioner, so I don't have all kinds of patient stories, but I have stories about me. And I've always been cold all my life. I've been cold, and then as I get older, that's gets worse and worse. And maybe 5 years ago, when I was playing with making pills and stuff like that, I said, I'm going to make me some Shenqi Wan, which of course is this kidney yang supplementing formula that has foods aconite in it. And everybody's scared of aconite. And it's like, well, I'll try this. And even you grind it and you make the pills with the powder, and it's not even cooked. So I'm like a little nervous, but I make these honey pills because I'd go to bed and it would take an hour for my feet to warm up, and I couldn't fall
Wow.
asleep until my feet warmed up, and I was just so cold, even in the winters in California. So I took it for um, 10 days, this homemade Shenchiwan. And at 10 days, I started to get a little bit of hot flashes, which I don't normally get. So I stopped and I thought I can take, more doses if I need it later, but, let's take some time off. And I have never had the cold feet problem since then. And that was like 6 years ago, 10 days. And
Wow.
before that, I had like bought the little, prepared pills that you can buy in the Chinese herb stores of Shenqiwan, and they never did anything for me. Never did anything but 10 days of homemade honey pills, and my feet get cold, but they also warm up in a reasonable amount of time.
Yeah.
So
Yeah.
there's
You have
some,
normal circulation now that is actually warming up your extremities.
yeah, and it's lasted how many years?
Oh
That's
my God, that's
amazing.
fascinating. And you're still alive. You did not suffer aconite poisoning.
I didn't have any side effects. Of course, you need this prescribed by a qualified practitioner who has experience and so forth. This is not, do not try this at home, boys and girls.
The disclaimer that we will say here on this podcast, yes.
Yeah, yeah. I'm just saying that when I take homemade, home prepared medicines, they work so much better than anything I've ever bought in a store.
Oh, I hope that after listening to this, a lot of our practitioners here will take this as some inspiration to go home and play around maybe a little bit more with the herbs, try them on themselves, maybe try some of the different forms that we've spoke about here of taking the medicine, and then hopefully bring that into the clinic to prescribe for their patients as well. We are getting close to wrapping up. So before we do, and thank you, I'm going to have food for thought for the next many days in thinking about the differences between decoction and pill and powder, and how I want to continue to prescribe for my patients. But before we finish, I want to ask just a couple of things. First of all, what is next for you, right? In your immediate future, you mentioned that you are working on this Pauzher Dafa translation that may or may not ever see the light of day. Where are your interests taking you in the near future? You had spoken about the differences between, let's say, a decoction and a pill and a tablet. I would love to hear more about that. I'm sure that many of our listeners have preferences, but may not know what the preferred reasons for prescribing one method over another is. So, as a jumping off point, anywhere you would like to start with that, I would love to hear more.
When I was a student, I always wondered, why is this formula Xiaoyao San and not Tong? I'm assuming that most of the listeners know Chinese medicine to some degree, but a san is a powder formulation. That means the herbs are ground into a powder, not granules. And a tong is a decoction, and why are some wan, which are pills, and even among pills, why are some honey pills and why are some water? And nobody ever addressed that. And then I'm translating a book called Pauzher Dafa, which is Pauzher is how you process herbs, and Dafa is just like the methods of processing herbs. But it had a whole section on not only the individual herbs and how you process them, but cooking herbs and making herbal formulations. That book's not published, by the way. I've translated it, but it's not published. And
Stay tuned for more on that.
I don't know if it ever will be. Sometimes you get like 85% done and there are just some problems that you can't resolve. Mm-hmm. So I can use it for my own purposes or in teaching. There's a thing in it which I also found in Li Shizhen's Ban Sao Gangmu, which is a really famous Ming Dynasty book. And it says, and this works much better in Chinese. There's no way to translate it in English and retain the flavor of the Chinese, but it says, decoctions are good for washing away disease or sweeping away disease because it's a liquid, so it sweeps it, it washes it away. But in Chinese, tong, which is decoction, and sweeping away is dang. So it rhymes in Chinese, but I can't make a rhyme in English. So it's really concise in Chinese and catchy, but in English, there's no way to capture that. So decoctions sweep away strong disease and powders scatter. So the word powder is san, S-A-N, and the word scatter is exactly the same character, but it has a different tone for the pronunciation. So it's saying san is san, powders scatter. And so if you go and look at all of the san formulas, almost all of them are for some kind of accumulation that you want to scatter. like Shaya-san, liver chi is constrained. You want to scatter that. Renchen Baidu-san, you're still scattering evils and so forth. The exceptions or powders are also used in emergency situations. So Shunmai-san, restore the pulse powder, is for emergencies because you can have the powder ready and you just pour hot water on it and it's done. So the exception for powder scattering are for emergency formulas. And then it says pills are slow and gentle. It's like Juan is Juan. And this word Juan means both slow and gentle. It's like Juan Mai, the moderate pulse. That's telling us that for acute things, you're probably not going to take pills for the most part. There's some exceptions again because pills can be prepared in advance, but you'll take them more for chronic because they're slow and gentle. So that's the first thing. And that totally blew me away when I looked at all the state board formulas or all the formulas on the national list of formulas. And you look at powders, you see all of them have some aspect of, dispersing something that's accumulated, scattering evils or something. And that just was like, wow, that's a whole new idea. And of course, why do powders scatter? You put some powder in your hand and you go, and it just scatters, right? Then another thing that I came across is that honey pills, I'm paraphrasing this, I'm not trying to quote, but honey pills are big and heavy, so they tend to go to the lower jiao. And if you look at most recipes that were originally made as honey pills, they go to the lower jiao, like Shenqi Wan or Luwei Dihuang Wan go to the lower jiao because they're heavy, so they fall deep. And then water pills are smaller. Honey pills you can chew, so they're bigger because you can chew them up. Water pills you can't chew, you have to swallow them, so they're much smaller. And they tend to go maybe to the middle jiao, like Baohe Wan is the middle jiao thing. And it's a water pill originally. And then powders tend much more to focus on the upper jiao because they're light and they float, like, wow, there's like a chi reason for, isn't that amazing?
You're blowing my mind
Then,
right now.
yeah, it totally blew me away. And then it also says that powders aren't good for channel problems because powders scatter. They're like wei qi. They go outward, they don't stay inside. And, so there's all of this stuff. It's like the doctors actually picked, why is this a pill? Why is this a powder? Why is this a decoction? For very specific reasons. And what I wonder is that if we just make everything a decoction or if we make everything granules, are we losing some amount of the efficacy? I know Western medicine would say nah, but
fascinating. And what a great question for us as practitioners to think about. And we're lucky in this modern day and age that we legitimately have access to all of these different versions of prescriptions, right? We can either purchase or make honey pills. We can purchase decoctions or have our patients make decoctions. And we certainly can purchase granules, tablets, capsules. So we do have the choice to prescribe based on what formula we want to prescribe or what the patient's diagnosis is. But how many people know this information? I would venture to say not many.
Yeah. I do have a video about this on YouTube where you can see the quotes from the book. You can see Chinese in my translation and stuff. Yeah. So somebody who wants to know more can look at that. That just totally blew me away, those ideas.
Yeah, that is fascinating. And I was just about to say you should teach a class on this. I suppose this podcast is now going to give people some of this information. So this is a good starting point for this. But wow. What an interesting way to look at the medicine that has been neglected and, could potentially help us become more efficacious in our prescriptions.
And the other thing I want to say is in the old books, they often, for a formula, some powder for a particular herb. Like this herb should be vinegar fried and that herb should be wine fried and this herb should be dry stir fried and so forth. And I really think if we're not doing the powder and if we're not putting it in the format, pills or powders or whatever, really, how much are we losing bit by bit? I mean, maybe one of those is a small thing, maybe the other of those is a small thing, but when we just, use granules, I'm not saying granules are bad, they're certainly convenient, and it's better to have something the patient will take than to have something that's perfect, but they won't take it.
Right. Absolutely.
I'm done with that book. That was a few years ago when I was doing all the medicine making stuff. What am I doing next? I kind of got tired of doing books. Theoretically, books are a great idea, but it's like so much work to perfect something, and it's so much easier just to get it like 90% done and then use it in teaching or just for my personal interest. I have so many books that I've like 90% or 85% translated, and I just don't feel like cleaning them up. And you never make money on books anyway. It's like royalties for a year on a book might be $300 or something. After the first year, maybe you get more, right?
Yeah.
When a book first comes out. But it's like you don't make money writing.
Well, maybe you'll get a little spike in royalties after this podcast, right?
Yeah, maybe. I got a spike after Lisa C's book came out, and then Miscellaneous Records had a pretty big spike. So I guess some people got interested in that. Anyway, so I just kind of like researching stuff for myself and then posting it in Facebook and Scholars of Chinese Medicine, do you know White Pine Circle?
I don't know if I do. No.
I wish it was more busy, but it's, a forum. And so I've been posting stuff there. And I just want to research what I want to research. I don't even care if it's practical that much. I like researching into ghosts in Chinese medicine or goo, weird stories or historical stories of Chinese medicine. I just found a story of this doctor in, I don't know what year, maybe 450 or something. And there's this story in a history book of him treating a ghost for back pain. The ghost had back pain, and he made an effigy of the ghost, and then he treated the effigy for back pain, and then the ghost got better and was happy.
Oh my goodness.
I just like this stuff.
I should invite you back in the future for an entire discussion about ghosts and goo. How about that? We'll
for Halloween issue.
Yeah, that'll be our Halloween issue. You'll hear from me again in about 6 months.
Okay.
Oh my gosh. One last question before we wrap up. I think I'm probably going to be asking all of my interviewees this question, but is there anything that you would like to share with our listeners that that we don't know about you? Any unique hobbies or interests or just something about yourself that you would like people to know?
I just fall down rabbit holes and then it's like a new thing. But fortunately for me, for the last few decades, it's all been related to Chinese medicine for the most part. This is like the only thing I haven't gotten bored with because there's just so much there, so much interesting stuff and so much stuff that's not available in English. So I don't really have, that's my life. And I'll tell you, in recent years, I've finally figured out that I'm a bit into the spectrum. And so I have this ability to just like focus.
Yeah.
And so it's my superpower, but it's also my kryptonite because remember, I don't get humans. And that's part of, being spectral. So, once I figured that out, it just kind of even empowered me to, accept that I don't get humans and that I do get like translating old books and stuff like that. And it's like, hey, why be normal?
Why? Well,
it's
and we are all
anyway for me.
We're all really lucky that you've embraced that and you have gone down these rabbit holes to really just offer up this information. Thank you for being a guest today on my podcast.
This is fun. Thank you so much.
Thank you, Dr. Lorraine. And in Health and Optimism, I'm signing off. Thank you. I'm your host, Gretchen Badami. That's all for today's episode of Elevated Practice. I'd like to express my gratitude to our guests today and always for sharing their wisdom with all our listeners. I hope you were able to take away some insights, practical knowledge, or inspirational ideas that you can apply right away to elevate your own practice. You can find us on Spotify, Apple Podcasts, and YouTube. Don't forget to subscribe and tell your friends and colleagues about elevated practice. If you have an idea for an episode or a recommendation for a guest, please respond in the comments or message me, Gretchen Badami, directly through social media. Thank you, and I can't wait for you to hear our next episode.